Hello,
Hello, hello.
hello, everyone. Good morning, good evening, good night, whatever. How is everyone doing? Sorry, I'm squinting my eye. I can't. My eye is a bit sore right now because I lost my glasses. But anyway, it's good.
No,
Do you
no, Temi. How
do you,
does that happen?
do you know how many glasses I have? You don't
I
want.
know, that's why it's impossible for me to think you lost your glasses.
I can't believe I've been driving the truck. So I think that's one the problem is. But it's good to be here whenever there's the show. Thank you to Professor Mimi. Even though you are in Dakar, you are in Egypt, wherever, River Nile and River, all the rivers, the show has to go. I'm laughing
The show has
because
to go on.
you're the one that is upholding this the what the ethos of the show. It has to go. But yeah, Deborah, we were supposed to be talking about the lady Deborah today, but Deborah's last baby turned 21st yesterday. And I can't wait for her to come and tell us how it is because I saw some photos and it looks like serious ritual. I don't think it's like the birthday as we know it with the costumes, everything that I saw. I don't know. So but at the moment she's at the airport, she's not here. So her conversation uh will be postponed till maybe next week when she's here. But it's good to be here and I'm very happy to see everyone. You could not tell that Miss Greatness has been under the weather. You could not. Can you tell me?
Absolutely not. And that's what makes her great because, she can carry herself and she can manage it all. But, you still have to have that self care. It's so important.
Yeah,
But really good to see
yeah,
you after a while. Please.
yeah.
Welcome
No,
back.
it was really tough. I just finished the show last week and came Tuesday. I don't know where the hay fever came from. I was down with hay fever. So I'm literally coming out today after I went back in last week, Monday. So
Wow.
it was tough. It was
For
really tough.
for a whole week, I didn't even realize that. Wow. But I pray that now that you are up, you are up. You're not going down no more. I pray.
Yeah, feel
Hmm.
much better. I feel much better actually. Thank you.
Thank God. So you see, the show will make us all well because we have to. Even Mimi also was just finished. Mimi, tell us about your program. You've been gone for a week. You just out.
Yeah.
Unbelievable. Mm.
I've had a very big week. So, which is why last week I literally landed in Cairo an hour before the show. So,
Mhm.
but I mean, immigration, I must tell you, I must compliment them. It was swift. You just pay what you have to get your visa, and within 10 minutes or so, I was done. Um, but then I had to get into my hotel check-in, and I think I was fatigued by all the travel you can imagine from Australia. But it's been the African Health ExCon organized by the Egyptian Health Authority in collaboration with Africa CDC. And you had participants from academia and think about who is who in the healthcare space. And also we had an exhibition along concurrently with the conference. An exhibition is on technology, or the focus was technology, but also appliances that are used in healthcare. And again, you can think about any technology, any appliance from X-rays to incubators, to name it. There were exhibitions about that. So with over 40,000 people attending, the
Wow.
structures is big, it's huge, but there's quite great representation from, from across the continent, of course, respective ministers of health. And of course, I'm in the public health stream, and I had the honor to give two
Yeah.
speeches in different sessions, but also participate in different, follow me on LinkedIn I normally like to do summaries of some of these meetings. So, like literally, the level of engagement, just to showcase, just to give a little bit of an idea why it is important and why universal healthcare in this current situation is so important for the African continent. And we can see that this is happening, it is in process, and there's significant commitment from funding bodies, but also from respective agencies, including governance bodies on the continent, and of course partners, WHO and the others. So it was quite a significant conference, but it was important that I'm here. So I'm just sitting here and looking over the Nile.
I was gonna say, I don't know if I saw your view, amazing. That it just looks like you're in Queensland, so beautiful. But anyhow, I was trying to use my leg to say, did you see any of our minister from Nigeria? Do they look like we're going to introduce any of this in 30 years time? Is it from?
Nigeria was very well represented by different academics, but also NGOs, NGOs from Nigeria. I don't recall meeting the Minister of Health, but it was a big space. But regardless, I think I met with the Minister of Health from Namibia, Uganda, Gambia, and a few others. So then there was the former Minister of Health from Ghana, who was also the chair of the African Education Fund. But again, it was a big space, right? And you focus in your different sessions, etc. So but I think I met some really significant decision makers in that policy and health space from Nigeria as well.
I know it's not our topic today, but the essence of this sort of meeting, Mimi, does it mean that they will introduce this technology into the system? Is that what, or they just showing the people on how to use it, or are they going to fund each nation? I just want to know if we're looking at anything promising for the future.
I think in summary, the exhibition highlighted the capabilities in terms of the technologies that are available, but also how the continent can harness and leverage on this. You had funding bodies and partners and respect and MOU signed. But something that really stood out, and I think I highlighted this in one of my write-ups online, was vaccine production on the continent, which COVID-19 highlighted that less than 1% of vaccines were produced on the continent. At the moment, Africa has made a commitment that by 2040, 60% of not just vaccines, but other medication, I think, will be produced on the continent. The pharmaceutical companies, again, pharmaceutical companies from the continent and outside of the African continent were present, showcased their product. So bilateral partnerships, strategic leadership. So lots of conversations. So you had different, and again, that was the exhibition. And as I said, think about this specialty in health, urology, cardiothoracic surgery, name it, everybody was represented in one way or the other. And then I'm talking north to south, east, west. And it's a big commitment here, I think, in Egypt on behalf of the Egyptian government and, of course, under the leadership of the Egyptian Health Authority and Africa CDC, which, again, if you think about it, only 15 years ago, it was more like discussion having African CDC. Today is a reality, and they're really doing significant work in that area. So I think, again, Africans or people of African descent around the world, there are opportunities to participate, to engage, to bring your leadership, bring in your skills, but also to work with partners on the continent. I think it's fulfilling, it can be challenging, but of course it's quite
very good.
fulfilling at the same time. Last but not least, the conference itself, you had different streams. And as I said earlier, it was a big space. And where you're thinking thousands and thousands of people, you need to actually have focus in order to ensure that you can have meaningful outcomes.
That's true.
The different sessions that I was fully engaged, there was one on AI, there was one on data, and of course I was present in the public health related session, which was my main area of expertise and why I'm here. And of course, there were different sessions on leadership. I saw something around the mental health streams. There were other streams. I think in the use of innovative technology system. The program was detailed. Go online, look at African Health ExCom. The person who opened the meeting this time was the Deputy Prime Minister. The previous meeting I attended was opened by the President himself, President LCC himself. And, there were closed sessions. So I think that's a good snapshot of what I can give, considering the time that we have for the show. Thanks for the opportunity.
Thank you so much. I like that. I think where our area of focus should just be on this and on what Liz is doing and what I'm doing. And next week we're going to go to our topic. I don't think we will do justice for our topic, but Liz, I'm very interested in what Mimi, the conference that she attended for Africa. Really, I think when there's a platform like that, it gives opportunity for people to be able to think forward, and like they can leverage each other, and also be exposed to what is happening. Like if I'm a private entity, even I attended that program, I will be able to see one or two people that I can connect with to be able to even resource my practice, even as an individual. So as a nation, I can see what benefit these sort of things can even create for Africa as a nation. It looks like a really, really good, because when you are talking, Mimi, my mind is going to who can I talk to, which department can I go, which breakup session can I attend to be able to benefit and bless my country. I'm looking at that. But Namibia, they are far ahead of us. That woman is going like a firecracker right there, And Namibia, that's why Liz is sitting cool, because she knows Africa is progressing so rapidly.
Yeah, well, I saw online that indeed our minister and part of the delegation did attend this is it an exhibition or the conference? And yeah, they also apparently are one of the 4 countries in Africa that has got one of the state-of-the-art heart something facility.
Is what?
Something for the heart. I don't know. Yeah. So one of the 4 countries in Africa that has got some facility that deals with the heart. So Namibia is definitely making a few strides, but there is a whole lot of room for improvement, because as much as the country is striving after innovation, maintenance of the existing facilities and structures is a problem. So I think there is a lot that needs to go into maintenance, and equally a lot that needs to go into reaching the people in the rural areas with the facilities. That's equally a challenge. There's people live really, they are spread out across the country, and how rural areas look like, seriously.
Yeah.
So it really becomes challenging for the people who live so remote that they are so far from the facilities, honestly. And I can't believe that we still have got people who live so far from the facilities. So that's one thing. Our minister acknowledges it, and I believe we can only hope for more work, more money, as Dr. Mimi says. The funding bodies were there, so we become more aware of the funding opportunities that are there, and that we can benefit from those funds, including Australia. I don't know if Australia does apply for funding. I think Dr. Mimi may help me here, because
Professor Mimi, sorry.
Yeah. Thank you. Yeah, Prof. we are fundraising here for a MRI. Is it a machine or a facility?
Yeah, machine.
Machine.
Eh, for an MRI machine. This is a community of about 20,000 people, and we've been fundraising. I think since I came, right now our funds stand somewhere at around 2 million something.
Oh,
Um, and I was just wondering, when you were saying or talking about the funding bodies, from the country perspective in terms of Australia, does Australia also, reach out for funds like that, or are we just a self-reliant country?
we have too much money
Okay.
there.
I think there are a few things that you've raised there. I'll start by acknowledging your minister, and I had opportunity over a couple of days and times to chat with her, but also the ambassador of Namibia here. And that's I don't like to go into those details. So was like the First Lady of Lesotho and members of Parliament from the Pan African Parliament and all the others. So it was about decision making. It was about that strategic presence, etc. And yes, one of the challenges that we continue to face on the African continent, especially with the smaller countries, is the land mass, the geographical expanse of the
Yeah,
Mm,
of the continent, but also, for example, it was not just Namibia. I know Lesotho also talked about, having a population of a few million people, yet being in space the size of France, for example. So ensuring access across the country can really be a challenge. So the most important thing I think we can say is that there's acknowledgement of that as a challenge, but then
yeah,
there's also structures, and there are structures in place to help mitigate some of
yeah,
these challenges that are facing the continent. Then, in terms of funding, when it comes to continental decision making, of course, the Union is the main development body, governance body on the continent, but we also have the African Development Bank. And I met somebody who is also the chair of the African Education Fund, but also who doubles as the previous Minister of Education from Ghana, I think, and others.
education fund.
But then we also have collaborators and partners. WHO, WHO had a very strong presence in different spaces, and so was NEPAD amongst other UN agencies and bodies. So, in terms of funding, I believe that self reliance for Africa, we have everything. Africa has got every resource, and that is what we should be pushing for rather than external funding. uh, Again, every government around the world has got their priorities and strategic areas. And
Yeah.
you mentioned Australia. Australia is great, gives a lot of funding here and there, but we also have to think geographically, we are in the Asia Pacific region.
Mm-hmm.
So strategically, the focus is in that region when you really come to think about it.
That's true.
Whereas, okay, you have a strong presence of the European partners as well within Africa because of the work that they do. But it's quite interesting. I mean, I think, my photo feed visit to Egypt, every time is different. And this time, what is different as well is the infrastructure within the country itself and how much they are moving leaps and bounds. But also technology, because years ago, over 2 decades ago, I know that they had invested significantly in the area of technology, and a lot of Egyptians work around the North Africa Gulf regions in the technology space. But manufacturing, I think of about 20 pharmaceutical vaccine manufacturing plants here on the continent. It will have on average about 7 of them.
Mm.
South Africa hosts quite a few, and then the others are spread across. So that is where I think that leadership is there. There is no scarcity of human resources. There's no
Yeah.
scarcity of talent. There is
Mm-hmm.
no scarcity of
Skills.
willingness to
Mm.
lead and do the things amongst African people.
Right.
I think we should be asking, are they going to be left alone to take ownership and also and do things that to serve their people, especially when it comes to universal health coverage? I think that's the bigger question, because we have the resources on this continent, and you can see it. I can see it.
Yeah, we do. We have a lot, and actually, Australians send a lot of chains to nations, even African continents. They do send through some NGOs, through some organizations. You can access even MRI machine because some of the big hospitals they replenish their machines so often. The moment there's another introduction to the system to enhance it, the other one is obsolete and they push it out, and it can go. But the problem, you just said it before, Liz, is the maintenance, is the sustainability. I'm so sorry. Sometimes our people don't know how to maintain stuff. They don't know how to. So you go to the hospital, like the maternity hospital that I'm trying to support in my village. You go there, you see weed all over the place. You don't need funding to do that. Just do the weed. Most of you are farmers in this village. So why can't you do the weed? Why can't you put some plants there? So a lot of it also needs some education. I know that you were saying a World Health Organization and African Education Council, whatever use that one is, they need to be teaching our people the right, like especially sustainability. I know, at least you just hit it on the head. They need to be doing it because you go to some of the hospitals, you see the hospital bed is so dilapidated. They make bed in Africa. We don't need to use Western bed. There are beautiful beds that they make there that we can even, some people can donate, like what Prof said. We need to also self-sufficient in a lot of ways because we have the skills, but we don't have the will. People that can do it, but they don't have the heart towards this kind of a thing. We're always looking out, we're not looking in. So we need to start to actually exercise what we preach. I know they want to self-sustain, self-reliance, but you're not building yourself up. You have the skills, you have the talent, you have the manpower, but we're not building. Like what you said about the remote areas that are poor. You come to a place like Western world, you go to Little River. Everything they have there, they have it in the metropolitan city. They actually want to reduce the amount of people in the metro. They want to push them out back. But then before the little village in Western world like Australia, before they start to construct anything in the remote area, they will put facility first, even before the people. They will start to say there's going to be supermarket coming up here, there's going to be clinic, everything is all marked up. What are we doing in our nation? Because there's no reason why those things in the city cannot go. They just want it to be only for the few, only for the one of the hundreds, only for the rich. And so it is quite unfair. I think what we need mostly, if I go to that sort of exhibition, I'm going to be talking about self-reliance. Whatever you preach, do it. Let this exercise start from home. There's no reason why some people should
I
be.
I think you said some really key things there. First, it is by invitation, or at least I've always only attended by invitation, so I'm not sure otherwise. So they're very strategic, and those conversations are being had. And this is where leadership is so important. I think when you look here, one of the things that was so obvious to me was the medical tourism that happens in North Africa. And that is something that, again, I'm happy to have a conversation with people at some point, in terms of instead of people flying to places like India, and the agencies that we have here on the continent, but also the resources that really value you. It doesn't mean that the other places that don't, but it is going to be much more cost effective of you seeking treatment, quality, first class treatment here on the continent. But that said, why is it that the governments of each nation are not ensuring that the healthcare system in their own countries are self-reliant for its people?
Yeah.
The private partnerships, which is something again that I spoke on, have a place. The private public partnerships. I think that is something that we should be working really hard in pushing on the continent, where governments have to work with the private sector to
Uh-huh.
ensure that these facilities are funded, but also they are sustainable.
Yeah.
Because sustainability by the people, for the people, with the people, is going
Mhm.
to ensure that the properties and the infrastructure is well managed. So it is
Mhm.
not a lack of talent, it is not a lack of knowledge.
Yeah.
Africa is riddled with every policy and every instrument that was ever passed out there. They have signed it. So
Mm.
I think through your own governments, through your networks, and I'm here, speak to me.
I know. It's we need to keep talking about this. I think most importantly for me is that sort of narrative that we need to keep pushing. One time I was asking Rotary Club, for example, to support the initiative of that hospital back in Africa, and one of the things they asked for was sustainability. How are they going to continue to manage this? They were big on this, that you need to prove to us that if we send container load of these things to Africa, they're going to maintain it. So we have spreadsheet on spreadsheet to be able to prove to them, because they really don't trust that we do this because of experience that they have. So even Liz, Namibia can partner with few organizations that I'm part of here, that they can give you that sort of the machine that you're looking for. And you said you've got 2 million. What are they doing with it? Are they buying the equipment now? Is there enough money to buy it, or do
This
you
is
see?
this is for here in Swan Hill, right? It's not a Namibian campaign.
All
It's
right.
a Swan Hill campaign, and that's why I was asking, does Australia also, fundraise or have those some strategic conversations to source funds from outside? But yeah, it's been quite a while since we've been fundraising, but now it's standing at about 2 point something million, and I think we making inroads slowly.
They don't fund outside. Which outside are they going to go? They fund inside. So like last, I think 2 years ago, the insurance NIBA, National Insurance Scheme in the whole of Australia, they did a gala night and they raised, I don't know how many millions in one night for a project. So you see that we do Royal Children Hospital fundraising. We all buy tickets there. We take it to our children's schools, and that's how they raise the money, is indoor. You see the school, they will send chocolate home. Those chocolate, they're not cheap. You might get $30,000 worth of chocolate. They give it to every kid, and all the money comes in. This is how the Australian government is very creative, and even the states and the local government, they're very creative in sourcing their fund. But these sort of things probably will not work in Africa. We always look out. But even if we look out, the problem is, can they keep building on that? So you don't continue. They're looking for a catheter bag, for example. We still don't have ordinary catheter bag. You can get that in every little supermarket all over my streets. But they go to a nation, you're looking for that in the whole country, like you're looking for diamond. Very hard to get ordinary catheter, or maybe blood sugar machine, for example. This is, they give it to people for free here. If you're actually diagnosed, you sleep, all you have to do is sleep in the hospital for 2 nights. You diagnose and certify that you have diabetes, they give you the machine for free, and you
So
continue to
I
get.
think, yeah, I think you've touched on a few things there in
Yeah.
terms of the service provision, the accessibility
Yeah.
to services, but also sustainability, which I've highlighted. But you also
Mm.
touch on Rotary and the
Yeah.
funding that you
Yes.
talked about. I think I would encourage people as well to be part of Rotary. That includes me. I am a part of Rotary. And the
Mm.
coincidence is, when I was coming here, one of the things, my Rotary Club, which is the Rotary Club of Melbourne, and I'm reading the book. So I'm
Oh.
telling you, don't
Yes.
sleep on my table, because in between anything that I have, yeah, literally. But I had to bring a flag to one of the sister clubs here, to one of the clubs here. So I did that
Oh,
yesterday.
very nice.
Absolutely. We need to be able to participate as well and give back. And I say to people, if they join Rotary because they want to just have access to funding and all of that, they'll get very frustrated very quickly. It is
Very,
also
very,
about service. It's about
very,
absolutely
I know.
very quickly. There are opportunities and a lot of good people. There are lots of organizations willing to partner, to support, and to do things with you. But you have to also be
Mm,
able to get out of your way, go
mm,
into other places, and also support other groups and other people. I think
yeah,
it is that altruism, it is that reciprocal type of relationship and partnerships. And I
yeah,
talk about meaningful partnerships all the time where it
yeah,
focuses on collaborations, people are at equal level rather than, you have to come to us, but then it diminishes your position as well in that negotiation relationship. So we need to
I like
think
that.
about it. And I think our African countries are doing very well in certain areas. I know that the media and other places, they highlight the challenges, but honestly, with what they have and the constraints, you have to also think about the political constraints that are
Mm,
imposed on Africans. And I'll give an example just here in terms of some of the countries, but is one of them, for example, that has
mm,
made the decision that they will not be exporting their diamonds unprocessed. But then you go to Ghana, they've tried to put policies around the export of their cocoa, having things like that processed on the continent.
they
Immediately,
started.
international bodies, and this is where with the whole world order thing comes in, policies and structures and whatever change, and it makes it difficult. It restricts those governments and the leaders. Because as much as there are failures in certain areas, we also have to acknowledge the constraints that are imposed on people who want to make meaningful decisions. And don't get me talking about President Traore and the success that he is, the
No,
leadership success, and yet the the constraints that they're trying to put on him and the limitations just to ensure that he is not successful. But I know he is going to be successful. I'm optimistic.
I know. They've been trying to blackmail him and give him bad names, but I just pray that if it's the plight of the negative people, they will not succeed. But thank you. Whenever you speak, Prof, I actually get some fulfillment because you're giving us hope that Africa we're on the right path and we're progressive. And I really want to hear that because it always breaks my heart how much I love that nation, and to see it go down, it's not going to be okay. So thank you for always coming back and talk to us about how they're not sending diamond unrefined. They send diamond and then we buy the diamond for $10,000, $20,000, but this is just from my backyard anyway, and we don't have access to it. They take our cocoa and then we buy chocolate so expensive, not even minding where it's from. So one day I'm hoping and I'm believing, and I think it's been an amazing conversation. We only have 30 minutes and it's been productive as far as I'm concerned for tonight. That's not the way we were going to go, but then we gone there. I thought let's just follow that trajectory. I hope you've been enriched by our conversation. And if you're African friend, an African wannabe, or you like the world as one, really, because if they said if they sneeze in America, we catch cold in Australia, and then Africa have shingles, whatever it is. So it's all a very small village until we start to actually really genuinely care about one another. Only then will we have a peaceful world to live in, I believe. Very simple. Miss Greatness, would you like to send us out tonight?
Yeah, look, I really appreciate, as you rightly said, the contribution from Prof. Mimi. We didn't expect this conversation to go all the way with, your introduction. But
Right.
obviously, with the little nuggets that you share, we've got to probe you more, and we know that you always have more that you have to elaborate and that you have to share just to make it clear, even for the layman to have an understanding of what you're sharing. And honestly speaking, there's very little that we hear about Africa, that is constructive. And when we have an opportunity to blow our own horn, why not? So thank you, Temi, for these 30 minutes that you have just given unto Dr. Mimi to be able to give it all out and inform us in terms of where we are heading when it comes to health and the related sectors and the related conversations in Africa.
Yeah.
Really well done. Thank you very, very much.
Thank you. I appreciate. Prof, we appreciate you. I pray that all your effort is never going to go. You're going to sit and see it translated tangibly, because all this is not easy. I know I travel as well and I'm tired, come back sometimes, whether you fly business or fly whatever. Sometimes it's not easy, but you're doing this not for yourself alone, but you're doing it for all of us, and you're well appreciated. Personally, I
Thanks.
appreciate it. Thank you. Thank you.
Thank you all. Thanks to the audience. Thanks for being here always.
Thanks for being here. We see you same time next week. Bye for now.
Goodbye.
Bye.